Hello to all my students and welcome to my channel Homeopathy with Dr. Mona Barnar. So in today's video, let's learn about Kent's 12 observations. Kent has written these 12 observations on the basis of understanding what the prognosis will be after giving a homeopathic medicine. So basically, when you give a homeopathic medicine, there are a lot of reactions and lot of effects which happen in the patient, and we need to understand and analyze the fact that what will be the prognosis and how will the patient progress further. So to understand that and to help us know that what are the precautions which have to be taken and what are the effects and what is the good part of the medicine, whether your remedy is working, whether your remedy is not working, whether it's a high potency, whether it's a low potency, we understand through these 12 observations. So let's understand these observations. So let's start with the video. So basically, as I told you that it's a prognosis of the observation. Basically, you're observing the action of the remedy. So it's a prognosis, it's an analysis, which you are trying to understand through these 12 observations, and you are able to understand what will happen next. So let's start with the first observation. So as the first observation talks about, it talks about a prolonged aggravation and final decline of the patient. So basically, this has happened. It's an observation that the patient has gone into a very bad aggravation, and finally the patient has collapsed, or finally the patient has died. Because what must have happened is that probably the remedy which you have given is antisoric, which is very deep acting, and probably the case is incurable. So, if the case is incurable, that means there is a deep pathology. The patient has a lot of pathology which is already gone deeper inside, and you have given an antisoric remedy, and that too with a very high potency. So, in such conditions, what are you supposed to do? So basically, in such conditions, you should never give a high potency. You should always avoid high potency. And when you know that the pathology is very deep and the patient, the case is incurable. So in such conditions, you should always give a 30th potency. 30 potency is the safest, and that helps the patient, and that doesn't bother the entire organ to go into failure, or the patient is in a better condition because the susceptibility is very, very low in such patients. It's an incurable case, as you all know. And then in such conditions, their susceptibility becomes very, very low. So in low susceptibility, you should never give a high potency. They can react very badly. So let's move on with the second observation. Now, second observation is long aggravation, but finally there is a improvement. So there can be a long aggravation, but finally the patient might become better. But the improvement is so slow that it is not visible very clearly. So the patient has a slow improvement, but there is an aggravation, which is very, very long. So now the inference is it's a good prognosis. The patient will definitely become better. Your simillimum is also correct, and that means you have given the right remedy. The disease is at a functional stage, so that means it's very superficial. The disease is not deep. So the patient has a very good susceptibility. The patient has a high susceptibility, and it's just a beginning of a tissue change. So basically, there is nothing which has gone deeper inside. There is no pathology which is involved, or it's just a change in the functions, and that's the reason why the patient is getting symptoms. So now in this condition, what do we do? So the solution is that you do not change the remedy. You don't do anything. You don't change the remedy. Your remedy is absolutely correct. It's a proper simulacrum. So in such aggravation, you try and give placebo. And as you know that the final recovery will be attained in few weeks. So that's the reason why you never change the remedy, because your remedy has been attained after a lot of understanding and analysis. So don't change the remedy. Don't think that your remedy is gone wrong. Let's go with the third observation. Now, the third observation, as you all know, that it's called as a homeopathic aggravation. So it talks about its aggravation is quick, short, and strong with rapid improvement of the patient. So this is a aggravation which is homeopathic aggravation, and here many people get such observations and get such reaction where the aggravation is quick and short, so it's just a heightened peak and then it comes down. So the patient, you will see such kind of observations in your patient also, where the patient might get a slight, very slight aggravation, and the patient eventually starts feeling better. So it's a basically the disease is superficial. This disease is at a surface level. It's a functional system which is involved. The vital organs are not involved, and the prognosis is definitely good. It's kind of a response which every physician would like to see such kind of response. So in such condition, what do? You do not change the remedy. If the generals are normal and if the generals are improved, that means the sleep is better, the moods are better, the mentally the patient is feeling better, appetite, urine stool, everything is fine. Then you don't change the remedy, because that means the patient has acted well with the remedy. You just have to check whether the disease symptoms are at the same level or whether they have gone deeper. If they have gone deeper, that means something is wrong. You are going inwards. That means your case is going in a pathological condition. So that is a wrong path. So it's better that you understand, analyze that what is the actual thing after giving the remedy, whether it's uh, the ideal observation which you have seen or it's something else. So, but as you know, if you know that it's just a slight aggravation and the patient is definitely going to become better after a lot of analysis, then you don't do anything. You just give placebo, because you need to allay the anxiety of the patient, because the patient is really very anxious after the aggravation. Let's go to the fourth observation. Now, fourth observation is no aggravation whatsoever with the recovery of the patient. Here, the patient does not get any aggravation. The patient is absolutely fine. You give the remedy. The patient comes after a week, and the patient says that I am not, I am better, and I don't have any problem. So here there is no organic disease. It's a chronic condition with no deep pathological affections. And disease is more at the level of the functions rather than at the tissue change. So, and whatever potency you have given is proper, it's exact. You don't need to do anything about it. So the solution here is that the response is that there is no need to change any remedy or nothing that you need to change. It's a correct remedy, and health will return in an orderly manner. Now, let's discuss about the fifth observation. Now, the fifth observation starts talking about amelioration comes first and then aggravation comes afterwards. Now, this is something which you need to be very vigilant about. The patient is having amelioration. That means the patient is initially better, and later on the patient gets aggravation. So now what have you done and what wrong has happened, that you need to understand. So the inference is that the remedy you have given was very superficial. So basically, it just touched the patient and then it went off. So it was a superficial remedy you gave the patient felt initially better, and then the patient did not feel better, or the patient got aggravated. So it basically acted like a palliative medicine. It just palliated the patient and then it went off. So, or it's a incurable case and remedy is somewhat suitable to it. So basically, probably it's a partial simillimum which you are talking about. So here, it's only the superficial symptoms which the remedy has made it better or cleared it. And then what happens is that the symptoms come back. So here, what is the solution to this is that you need to re-examine the patient and find whether the symptoms are related to the remedy. So basically, whichever symptoms are coming up, you need to examine and understand whether it's a remedy related or whether it is something the patient has had the symptoms. So if the remedy was similar to the most grievous symptoms, that did not cover the entire constitution of the patient. So wait till the symptoms come back in the original form. So probably the remedy was very similar to the most conspicuous or most obvious symptoms, and it did not cover the whole picture, or as we say that it was not a remedy which was covering up the whole patient or all the symptoms of the patient. It was just covering up the few symptoms which were very, very, very prominent, and that became better, and then later on the symptoms which were remaining came up on the surface. So you need to understand, you need to stop, and you need to understand whether the patient, the symptoms which are there, let it come in the original form, and then you decide what you want to do. Let's move further. So let's talk about the sixth observation. Here it's a to short relief of symptoms. That means the symptoms are becoming better for just a short period of time. Now, what is the conclusion to this? The conclusion is some condition that has interfered with the action of the remedy on the part of the patient or maybe intentional. So now what does it mean? Basically, this means that, say, for example, you have given a remedy to the patient and the patient has probably taken strong coffee, or the patient has inhaled camphor, or with because of something the remedy or the action of the remedy has got basically it has got hampered, and because of that the relief is too short. Either that can happen, or in acute cases when there is a heightened response, there is a high grade inflammatory response in acute cases. In such conditions also, the remedy which you have given shows the effect only for a certain period of time. That happens. The third thing is that in chronic cases, if the organs are destroyed and there is a structural deformity, structural changes have happened, in such conditions also there is very less relief of symptoms, or it's a too short relief of symptoms. So now what to do? So the solution is that for such changes, a physician needs to be a very good observer. You need to observe each and everything very, very clearly and very, very acutely. You need to understand the patient. You need to see what is bothering and how things are happening. And you need to ask the patient if the patient has taken any medicine or the patient has interfered with the remedy. So you need to be very vigilant and acute observer. The seventh observation. Now, the seventh observation talks about full-time amelioration of the symptoms, yet no special relief of the patient. That means the symptoms are absolutely fine. The patient had, whichever symptoms the patient had come up with, the symptoms are better, but the patient is not feeling relief. The patient is feeling that there are symptoms and they are suffering. So this happens in palliative conditions where the conditions are basically conditions like organic diseases, your improvement is not possible. So, because beyond a certain stage, you cannot give improvement to the patient. The patient has an incurable condition. You cannot give relief to the patient or cure the patient completely. So, in such conditions, cure cannot be attained to a particular level. It can be attained only to a particular condition. It can be only palliated. It cannot be attained completely. So you need to understand that. So the solution here is that remember that the stage is disease is at the stage where the cure is not possible. So you know that the pathology is deep, you know that the patient has an incurable condition. So there is no improvement or there is no cure in such condition. You need to only palliate. So only partial improvement is the treatment for the patient. So only temporary relief or just a partial improvement or just a palliative kind of improvement is the basic therapy for such patients. Eighth observation. Now, eighth observation, some patients prove every remedy they get. So basically, there are patients who prove each and every remedy. They will, whatever remedy you give, they will start showing up symptoms. And such patients are called as idiosyncratic patients, where they are either they are hysterical, they are oversensitive to things. You give a remedy and they show a heightened response, and you really cannot understand what to do with such patients. When you give the remedy, within 2 3 days, you will get a call that the entire disease symptoms have got flared up. Everything has got flared up, and you are in a state of panic. The patient is in a state of panic. You are in a state of panic because you really don't know what is happening. So such patients, you need to be very vigilant because they will make you lose your confidence. They will make you feel that you are not worthy enough to become a doctor. That's the reason why you need to be very, very calm and composed as a physician because they are suffering and they are abnormal, but you are normal. Okay. So their oversensitiveness is incurable. You cannot treat their sensitivity. They are such hypersensitive or they are such hysterical patients. So as they prove every remedy, they are called as ideal provers. So you need to understand they will prove each and every remedy you give them. So they are basically such people who are born with such heightened sensitivity. Ninth observation. Now, ninth observation basically talks about the action of medicine upon the provers. They are this observation is also called as drug proving, where you give a remedy and they prove the remedy. So they are benefited by the provings if they are properly conducted. So if you give the remedy to them, they prove it, and there are times when they become better with the remedy. So the solution is that take note of the constitutional states of an individual about to become a prover and to note down and then subtract them from the proving. So you get the proper understanding what remedy you have given and then you can understand the symptoms of it. They will prove those remedies. These symptoms will not commonly appear during the proving, and if they do, make note of the change in them. Now, 10th observation, new symptoms appearing after the remedy. So now you're in such conditions, you have given a remedy and there are new symptoms which are coming up. Those symptoms are not mentioned in the case history at all. These are the absolutely new symptoms which you have never heard in the patient. So now what has happened is that probably the prescription was unfavorable. You have given a completely wrong remedy. The remedy was not suitable for the patient at all. Or they can be old symptoms, which the patient must not have observed and is now thinking that it's a new symptom. It's not a new symptom at all. The patient must have had the symptom long back. The patient did not mention it. So it's an old symptom, probably. So now what to do? After these symptoms have passed away, the patient will settle down to the original state and there will be no further improvement. So now, after understanding and analyzing that these are the old symptoms which were there, you need to then think of giving the remedy that, okay, fine, these are the old symptoms which have appeared. That's how the patient has probably thought that it's a new symptom because they did not remember about it. Now, your 11th observation talks about actual old symptoms, when old symptoms are observed to reappear. So, here, this is a proper Hering's law of cure. It talks about the Hering's law of direction of cure, that is, the symptoms disappear in the reverse order of its appearance. So, this is a proper Hering's law, and the cure is definitely going to happen. The patient is absolutely going to become better. So now in such condition, what to do? Just leave the medicine just like that. Don't do anything. Let the remedy act in its own way. What you need to do is that if at all the symptoms which you have observed or the patient has observed, it's a old symptom. You just have to understand that if they become very obstinate, if they don't budge, they don't leave the patient, then you need to just repeat the dose of the whatever last remedy which you have given. Just repeat the dose. The 12th and the last observation. Now the symptoms take a complete wrong turn, complete wrong direction. The patient is in a mess because the symptoms have gone in a very wrong direction. The disease is going from the periphery to the center, which should be other way around. But here it's leaving the less important organs and it is going in the more important organs. So it is from periphery, it is going deeper inside in the center. So there is a violent internal distress that is settled in the major organs, and the patient is in a deep pathology and it's a complete mess. So here you immediately antidote the remedy, or else the structural symptoms will start settling and at new places. So just stop the remedy, retake the whole case, and the remedy which was selected, because the remedy which was selected was completely wrong. That's the reason why it has come in a wrong direction. So based on a completely new totality, you have to prescribe a different remedy because your remedy which you have given was completely wrong. And that's how you understand that this particular observation made you understand that your remedy was wrong. So now this is all about Kent's 12 observation. Thank you so much for watching. And if you want any other topics, please do let me know. Do comment and thanks for watching.